Looks like they had a rough night. I'm going to straighten up a bit. You never know what's coming in next. I'll meet you for our morning huddle in a few minutes.
Sounds good. Thank you. Hey, before you go, did you see the assignments? Who's running trauma team today?
You are. We have a lean team for the holiday, so hopefully won't be too busy.
Trauma confirmed. See you soon. I'm on trauma. I got it. Hello, this is Dr. Boyd. What's happening?
We have a 21-year-old male who fell from a ladder, alert and awake, but in pain and respiratory distress, boarded and collared, on 100% oxygen via face mask. Heart rate 110, BP 90 over pulse, ETA 5 minutes out.
Are there any other injuries?
That's all we know. Oh, they said they think he bit his tongue, might be a tough airway.
Okay, thank you. Okay, team. We have a 21-year-old male, status post-fall from ladder, awake and coming in via EMS backboard and collar with possible respiratory distress and 5 minutes out. Sounds like there could be an airway or breathing issue, so Hernan, can you call respiratory and have them set up for difficult airway just in case? We also need to worry about blunt abdominal trauma after fall. So Diane, we will need trauma labs and a fast ultrasound exam.
Do you want me to call the trauma team?
Yes. Great thought. Definitely meets criteria, and they can help with the fast. Thank you, Hernan. Please meet us in the trauma room after you page them. The patient's around 2 minutes out. Don't forget your PPE. Sounds like there's a lot of blood. Let's go. We're stretched thin today, so let's please go around and just clarify our roles. I'm Dr. Boyd. I'm running the event.
Daniel, I'll be documenting and helping with meds.
I'm Diane. I'm the bedside nurse.
Hernan, resident EM. Guess I'm on airway.
Are you comfortable intubating if you need to?
Yes, but if difficult, we should probably get anesthesia as backup.
Looks like we're low on saline.
Oh, good catch. Can you check next door to get some more before they arrive?
Yeah.
We'll need fluids. Hi, I'm Dr. Boyd. I'm in charge. Tell us a story.
This is a 21-year-old man, no past medical, who fell from a ladder, found down by the base of the tree, bad tongue lack, and breathing fast. He's got a ton of blood in the mouth. We suctioned a lot out, but breath sounds are equal bilaterally, and he's on 100% oxygen. We started 2 large bore IVs, and I got a liter of saline going in wide open, got him in a collar due to the fall. I'm worried about this guy's airway. He's got a nasty tongue lack. He's not on any meds, but does have an EpiPen, has a drug allergy to penicillin. He looks like he's breathing okay, but I'm worried about that tongue swelling up from the lack. What other questions you got, Doc?
Thank you. Sounds like this could be a difficult airway. Concerned about possible expanding hematoma and impending airway loss. Daniel, can you please call anesthesia and ask them to bring the video laryngoscope?
Got it. Anesthesia, bring the scope. Calling now.
Is the patient still responding?
He can't talk much from the lack, but he was nodding earlier.
Okay, thank you, Angela. We'll take it from here. Diane, can you please check that our access is okay and want another liter of saline?
I'll start the second bolus on the other side. The first one is almost done. Do you want me to run the other one at the same time?
Yes, great. Use both lines.
Anesthesiologist is on the way in 2 minutes, bringing video scope.
Okay, thanks. Daniel, Diane is hanging the first bolus. Can you please help prepare meds in case we need to intubate?
Sure thing. What do you want?
Let's go with etomidate and rock.
Okay, I'll check my med book.
Can you hear me?
Hey, be careful. Please try to keep your hands down or else the IV is going to come out. Is your stomach hurting you?
Hey, trauma surgery here. I'm Brian. What's going on?
Okay, everyone please quiet down. Let's recap for surgery. Are you the attending?
Third-year resident.
Okay, we have a 21-year-old male who fell from tree. In C collar, has tongue lack with concern for impending airway failure. We're setting up for difficult airway and anesthesia's on the way.
I'm here. I'm Teresa. I'm the fellow. My attending's stuck in the OR. I brought the video scope though because someone called ahead.
Oh, okay. Our EM resident Hernan set up airway stuff. Could you please help him out since we think it'll be a difficult airway? We've given first liter of saline, wide open, starting second soon. Still tachycardic and blood pressure is soft. Actually, Teresa, can you focus on airway stuff? And Hernan, can you get the ultrasound for the fast scan? Teresa, let us know what you need.
I think it might take 2 of us.
I can do the fast, but let me finish primary survey first.
Okay, so Brian is going to do the fast after completing primary survey, and Teresa and Hernan are going to let us know when they're ready to intubate.
Second liter is going in, but I think one of the lines might be blown.
Let's focus on primary survey so that we can get intubation in.
Can you please call out the primary survey so I can document?
Trachea midline, mouth with obvious oral trauma, blood in the mouth. Can I get suction, please? Bilateral breath sounds. Abdomen soft. Some tenderness.
I think his belly is definitely hurting him.
I'm ready to do the fast.
We need to roll the patient to check the back.
Well, let's see what the fast shows first.
Subxiphoid clear. Positive free fluid in right upper quadrant. There's a decent amount of blood in the belly. Can we cycle the blood pressure? We might need to go straight to OR if not responding to fluids. I'm gonna go call the OR.
Sats are dropping, high 80s.
Stats are dropping. We might need to intubate now. I need to call my attending. Right. I'm gonna need your help on this one in the trauma bay. There's blood in the airway with sats dropping. I'm going to proceed, but need to know my backup is on the way. Right. Yes, I have the video scope. Okay. Thank you. Bye. My attending is on the way, but we'll keep moving so we don't lose ground.
Just a second. Brian, we're about to intubate. I may need you for surgical airway as backup, if that's reasonable.
Okay, got it.
Okay, everyone, here's what I'm thinking. This patient needs the OR, but first we have two main issues. One, we need to secure the airway, impending respiratory failure. Second, we are hypertensive from probable hemorrhage in the abdomen and need to get to the OR. Does anyone else have any other thoughts? Diane, what do you think?
Well, I'm really worried about his arm being so swollen. This doesn't look right.
Do you want to hang some O-negative blood?
Yes. Can you call the blood bank to initiate massive transfusion protocol?
I'll get the blood.
Are you ready to intubate?
Dr. Boyd, I know we are worried about his airway, but his arm is really swollen. I can't get blood through this line.
I hear you, Diane. It's probably an infiltrated IV. Can you place another one?
Okay, I'll hang it. Actually, this IV is running fine, and it's nowhere near the swelling. Something else is definitely going on here, and I'm worried about his arm. Can you take a look?
Let's take a look at the arm. What does everybody think?
Yeah, that's a problem. Let's secure airway first, and then we'll figure out what's happening with that arm.
And decide if we need a CT scan for the abdomen.
Okay, Teresa will be in charge for the intubation. Let's have some quiet and listen to Teresa for what she needs. We have etomidate and rock ready if you want.
I need etomidate, fentanyl, and sucks.
Brian, we may need help with surgical airway. Look at his tongue.
This airway's getting pretty bloody.
But wow, it's not just his tongue that's swollen, his eyes and face too, plus his arm. Could this be an allergic reaction? Is that O-neg you're running?
Maybe he got a bug bite and that's what the arm swelling is from. He was outside climbing a tree. Do you think we should stop the blood and run epi?
Well, he's looked like that before he started the blood. He definitely needs the blood. His pressure has not been stable.
We need to get up to the OR. Maybe we should intubate once we're there. We have more tools.
Oh, Brian, I'm not sure we should transport him. It's a long way to the OR. His saturation's barely holding at 90%. Transport can be risky because his airway is tenuous. We could lose along the way, and enacting a plan B in the elevator won't be pretty. I think we need to secure airway before transport. My attending is on the way down here for additional support.
Okay, I'm setting up for surgical airway as plan B.
I agree. Let's stabilize the airway. Okay, everyone, here's where we are. We still need to secure an airway. We have a potential abdominal bleed, and we think it's safer to stay here and stabilize the patient before heading to the OR. Is that everyone's understanding?
Can I have the meds, please?
Do you still want fentanyl?
No. Can you monitor his vital signs? He's probably going to get hypotensive. Can you feel his belly? Our plan is to induce with etomidate and succinylcholine and then take a look with the video laryngoscope. If we can't get a good look, we'll mask or LMA. Brian may need to do a trach. How's that plan sound, everybody?
I agree. Sats are dropping. Daniel, can you pull out the LMA and have it nearby?
Ernan, can you apply cricoid pressure?
Got it.
Diane, can you give me any equipment that I may need?
Yes.
Brian, if we don't get the airway within 1 minute of induction, can you prep the neck for surgical airway?
Okay, got it.
Okay, now that the airway's secure, we need to get him to the OR. The team to go will be Ernan, Teresa, Brian, and Diane. I have to stay here in the unit. Renan, you will take over as leader for the transport. Teresa, you will manage the airway, and Brian will be there to help as well.
I'll switch over to the transport monitor. What meds do you want to take?
We need to
for
keep the
transport?
blood going and pressures are still soft. Do we have more bags yet from blood bank to send him with?
We just got 2 more bags.
Great. Anything else we need to anticipate?
Could we get a propofol drip to help with the tube for transport and emergency drugs?
Got it. Propofol and code drugs.
Okay. Other than the meds, are we ready to roll out?
Yep.
Oh, no, wait. This O2 tank is only half full. Let's grab another tank for transport. I'm sorry, I forgot your name. Could you grab me another tank?
Daniel, and yes, I'll grab one from next door, and I'll call ahead for the elevator.
OR is ready.
Okay, let's double check our pre-transport checklist.
Sorry, what's up?
Can we run through our transport checklist, please?
Sure thing. Monitor.
Check.
Airway.
Check, good airflow and tank level.
Lines clear and meds available?
Check. Blood and fluids on the stretcher. I have propofol and code meds just in case.
Route clear.
And receiving team and OR aware.
Good. Renan, your patient.
Let's roll. BP is 88/60 and falling. Should we give him fluid?
2 liters in and second unit of blood going. He's starting to look puffy.
Maybe he's getting abdominal compartment syndrome. We just have to get to the OR.
Ventilation is getting more difficult. There's no tube peak and he's not biting. But this feels harder than usual to bag. Maybe it's a mainstem intubation or a pneumothorax. I don't have my stethoscope. Diane, could you do me a favor and listen to his lungs? Should we stop here and assess?
Let's keep moving. We have to get to the OR. The airway pressures are because of the abdominal distension. He's bleeding in the belly. Just push the blood in faster and we have to get to the OR.
What else could we be missing?
I had a patient like this once with a bad liver lac. He bled to death because we couldn't get into the OR
I
fast
don't know, the
enough.
abdomen looks the same, but ventilation is getting harder and sats are dropping.
I can't hear breath
You
sounds.
can't hear breath sounds.
I still can't hear. Here, can you listen?
He's bleeding everywhere. He's probably bleeding in his chest too. Shoot, we forgot to wait for x-ray. Probably needs a chest tube. That other patient also had a liter of blood in his chest when we opened.
I hear breath sounds, but it's tight, wheezing everywhere. Could he be having an allergic reaction to the meds?
Yes. Look at his face and his hand. It's way worse.
Shoot, I forgot about the hand. Could be anaphylaxis.
Do we have any epi on us?
Yes, I brought code meds. How much do you want?
Do we all agree that we should try some epi?
Makes sense with ventilation and airway.
Yes, look at his face.
Not sure, but it won't hurt.
Okay, Diane, please give epi right away.
Hey, how'd it go?
We think the patient had anaphylaxis. We had to give epi.
Wow, from the blood?
No, we think he was stung by a bee and that's why he fell. Remember the hand?
Yeah. Teresa called it when she saw the tongue. Totally good catch.
Hey, why don't we have a quick debrief about the case? Can everybody take a minute before we go back to the unit?
Sure.
All right, I will set the timer for 5 minutes.
It would be great to have anesthesia and surgery here too for this.
Sure, but let's review together now. We can schedule a larger debrief at the interdisciplinary discussion later this month. This is a good case to review with a larger team.
All right, if it's good with everybody, as the documenter, I'll facilitate. And I'll just start by saying, if anybody needs to cool off or take a minute outside, you can do so at this time. That's great. And remember, we have formal resources for any staff in need of more support after challenging clinical events. All right, as Dr. Boyd mentioned, we'll be formally discussing the details of the case later in the month. So let's just use this time now to compare our mental model, review what we did well as a team, and if the same patient comes in again in 5 minutes, is there anything we might do differently? Can we start with initial reactions or any feelings we want to get off our chests?
I'm frustrated we didn't treat for anaphylaxis sooner. I knew that the patient's hand had something to do with this.
Well, we followed our algorithms and got the patient to OR where he belonged, so I think we did a good job.
Diane, tell us more about how you felt. What do you think contributed to your not feeling hurt about the patient's hand?
I mean, I guess I didn't know it was anaphylaxis or anything, but I kept saying, look at the hand, and I felt ignored. I wish I had pushed it a little bit more. Maybe if I had said it differently somehow.
Actually, I could tell that you were concerned, Diane, and there's nothing you could have said that would have pulled my attention. I was just fixed on hypertension being secondary to blood loss. I honestly didn't consider anaphylaxis.
Well, it's a good thing we cleaned out the trauma slot this morning. Otherwise, it would have really been a mess.
What else did we do well as a team?
I felt really supported by Dr. Boyd. I wasn't entirely confident with that airway. I'm glad we were able to get anesthesia there to help, and you made me feel comfortable saying that. And I think we did what was best for the patient.
Well, I really appreciated you being honest about your comfort level.
And you went with the plan to give Epi upstairs. As leader, you really listened to the team.
What do we think we could have done better? Was there any systems issues that maybe we don't want to forget to pass on from today?
Well, it would have been nice if the trauma room was restocked last night, or at least if we had been given a heads up about it.
Yeah, good point. I will pass that on to nurse management.
Also, I'm glad that trauma came to do the fast because we really needed another doctor in the room. I'm stressed that the rest of the ED got shut down because we were working on this.
All right, let's see. We've got a few minutes left before we all get back to work. Dr. Boyd, as a team leader, was there anything you thought could have run more smoothly?
Not really. I really appreciated everyone's contribution to the plan. There were some hairy moments, some things that didn't fit. I'm still reeling that I missed anaphylaxis.
But your orders were very clear. We always knew exactly what you were talking about, and we got the patient upstairs really quickly.
Oh. All right, that's it. Hey, everybody, before we get back to the unit, let's just take a minute. Let's recognize how amazing our work is. Because we worked as a team together, we got to save a life today. Right?
Back to work.